Estimation of serum creatinine and creatinine clearance. You people have idea about clearance? What is clearance? Removal of what? Pardon?
Unwanted particles.
Yeah, removal of unwanted particle is excretion. What do you understand by the word clearance? Get in. Pardon? Be loud. Whatever idea you have, urea clearance, do you know? Urea clearance has been covered, right? From the estimation of blood urea along with urea clearance. What do you understand by clearance? That's the simple thing I'm asking. Basically, let's say there is a substance X in the blood. How much? 100 ml. Now both the kidneys, how much amount of this X substance can excrete in 1 minute? That is known as clearance. Got it? Let's say 100 ml of creatinine is there. Just an example, 100 ml of creatinine is there in your blood. Both the kidneys are working to throw the creatinine. Now both this kidney can throw, let's say 50 ml of creatinine in 1 minute. So the clearance will be 50 ml per minute. Okay, so the percentage of the substance that both the kidneys can excrete in 1 minute is known as clearance. Okay, so this knowledge that you have gotten from your previous class, that will be used over here as well. Okay, so that is why I just asked whether you have the idea of clearance or not. Okay, now what are the kidney markers? What are the kidney markers? 2 kidney markers, tell me. Blood urea, serum creatinine, uric acid, these are all comes under the kidney markers. ओके हम लोग यूरिया इसलिए टेस्ट कर रहे थे ताकि हम लोग जान सके कि किडनी का कंडीशन कैसा है. व्हाट इज द नॉर्मल लेवल ऑफ यूरिया? Pardon? 15 to 40 mg. If somebody is having more than that, what is your prime suspect? Somebody who is having, let's say, 100 mg per dl of urea. What is your prime suspect? Primary suspect? Kidney is not working properly. That is why it cannot filter out the urea. Right? So whatever you are reading, you have to understand for which purpose I am using it. Just because I am estimating serum creatinine, blood urea, what is the point? What is the purpose of estimating it? Okay, to understand the kidney profile. Now there are 2 markers. Now you got to know that blood urea is also there, serum creatinine is also there. Now among these 2, which one is more specific for the kidney? Creatinine. Why? Why is it more specific for kidney? Why not urea? Specific for that particular organ, right? So urea can increase because of other things as well. If you are taking more amount of protein diet, urea can increase. Okay, but creatinine doesn't hamper by that. Creatinine is always proportional to your muscle mass. The more mass of muscle you have, the more will be the creatinine, but up to a certain limit. Okay, that we will come later on, that you will get to know. So that is why urea can increase by dietary intake, by other organ dysfunction. So it has multiple purpose of increasing, but creatinine has very specific criteria for the kidney only. If your kidney is not working, or you are having excess intake of creatine, those people who take protein, creatine monohydrate you can see in the protein bars or the jars, those who are excessively taking the proteins, they can have increased amount of creatine, which is bad for your kidney. That is why they say, like, whenever you are taking that powder, protein powder for bodybuilding, take it in a specific amount, not more than that. Excessive amount of it is not good for our health. Okay? Okay, that was just the superficial idea. Now, what is creatinine? Creatinine चीज है क्या? कहाँ से produce होता है? Anybody has any idea? मसल मास बड़ा होगा तो क्रिएटिनिन ज़्यादा होगा. ATP यूज अप होता है. ATP यूज अप होता है. First of all, there are 2 things. One is called creatine and another is creatinine. Okay? This thing you have to understand. Now creatine is synthesized in liver, to some extent in the kidney as well. Okay? Now this creatine gets converted into creatine phosphate. Okay? Now this creatine phosphate is produced with the use of ATP and converts into ADP. Means energy is being used up over here. And then it gets converted into creatine phosphate. Now both these things get stored in our muscle. okay, and gets used up in the muscle and they get dehydrated. Dehydrated means they lose one molecule of H2O. They lose H2O. Once they lose the H2O and they get dehydrated, they form the creatinine. Okay. Once this creatinine is formed, this is now unwanted material for us. These two acts as a source of energy. Okay. This creatinine is unwanted for our body. When this creatinine is formed, it will circulate in the blood, get to the kidney, and kidney will filter it out. Okay, and now this creatinine causes what? Whenever it goes to kidney, there is, let's say this is a glomerulus. Okay, this is your glomerular basement membrane. Now whenever the kidney goes over here, the kidney is not reabsorbed by the kidney. Okay, the creatinine is not getting reabsorbed by the kidney. Neither this creatinine is getting secreted by the kidney. Means kidney has no effect on the creatinine. जितना आता है उतना निकल भी जाता है. As simple as that. Okay. In case of urea, that is not the case. In case of urea, some bit of urea get reabsorbed. Okay. In case of creatinine also, creatinine get reabsorbed, but like very 0.0001%, like very less, which is negligible. जितना amount होता है वो negligible होता है. That is why whenever we are estimating the clearance, we prefer the creatine clearance more as compared to the urea clearance. Okay. In practical aspect, one product which is not being absorbed in your body and neither being secreted by the body. Okay, so that is a optimum product or optimum substance with which you can measure the clearance. Got it? Because on that substance there is no effect of the body. It will not get absorbed by the body, neither get secreted by the body. Got it? Okay, let's start the topic. So estimation of serum creatinine. Creatinine is produced in the muscles from creatine. Okay, the exact same step in the muscle, creatine से creatinine create होता है with a process called enzymatic irreversible dehydration. Why dehydration? Because these H2Os are getting out. Fine. Now creatine is synthesized in the liver and the kidney from the amino acids and passes into the circulation and is taken up by the skeletal muscles. Okay, whatever I have said in the diagram, that is what is written over here. About 2% of the total creatine is converted in daily into creatinine. Okay, whatever creatine stored we have in our body, of that 2% of it every day gets converted into creatinine and then gets excreted out. Okay, fine. Now the amount of the creatinine produced is related to the muscle mass. The more the muscle mass, the more will be the creatinine level in your body. Once the creatinine is produced, it is released into the blood and then excreted by the kidneys. Now the process, the test that we are performing today to estimate the serum creatinine. This test is known as the Jaffe's reaction. It has already been covered to you. Little bit of idea you have like about this Jaffe's reaction, what happens. Sir has told you already during your organic and inorganic substances of the urine, right? Remember? Okay. Now what happens in this test is creatine reacts with the picric acid. Okay. And in the presence of the alkali media, it forms a orange-red color. That is a creatinine picrate. Okay. See over here, creatine reacting with the picric acid in the presence of the alkaline medium and reforming the creatine picrate, which gives a color of orange to red color. And that's a chromogen that we are using in the colorimeter. Using the Beer-Lambert's law, we are checking the absorbance, and by seeing the absorbance, we are putting it down, absorbance of the test upon standard, and we are getting the value. The exact same process that you have already done in glucose, protein, urea, and now it's about creatinine. The principle is same, but over here the reaction is happening between creatinine and the picric acid and forming the creatinine picrate. The intensity of the orange-red color is a measure of what the amount of the creatinine present in the blood. The same thing, exact same process. Okay. And this reaction is known as the Jaffe's reaction. Okay. Everybody understood? Okay. Now somebody explain me then, proteins in the blood do not interfere as they are precipitated with tungstic acid. What do you mean by that? क्या होता क्या है कि that creatinine is reacting with picric acid. Okay, fine. Now whenever you are taking the blood sample, obviously there is not only creatinine. Protein is there. Ketone bodies, some amount of ketone bodies will be definitely be there within the normal range probably. Glucose is there, ascorbic acids are there, urea is there. These all can react with the picric acid. Okay, and the okay, thank you. The major quantity is the proteins and the ketone bodies. These are the major things that react with the picric acid, and these will also give the creatinine picrate like orange-red color complex chromogen. So when you are estimating, you will get a falsely high result. So that is why we have to precipitate the protein first. Now when you are performing the test, you will not get this separate step of precipitating the protein, because when we are giving you the sample, we have already precipitated it, and then only we will give you the serum sample, right? So somebody can ask you why this step, why you are writing this step, why you are precipitating the protein, so that it do not give you the falsely high result, first thing, okay? And this step is already done by us, you don't have to perform it. Later on when I will be going in the further in the topic, that time you will understand how we are doing it, okay? Everybody done now? Okay, next. So what are the reagents we are using? See over here, serum supernatant. Till now, whatever test we are doing only the serum sample, not the serum supernatant, okay? So this serum supernatant we are making. How? By precipitating the protein and the other substances. We will precipitate it and we will make the serum supernatant. Second thing is picric acid reagent, that is given inside your kit. Once you go to the lab, you can see that these kits are already given to you. Picric acid reagent, buffer reagent, that is L2, creatinine standard. What is the creatinine standard? Concentration is 2 mg per deciliter, okay? And distilled water. These are your reagents that we will be using. Now how to prepare the serum supernatant? For this kit, how we are taking it? Let's say we are taking this picric acid reagent, okay? The L1 reagent we will take how much? 2 ml, okay? And the serum sample that we are taking from the patient, we will take 0.2 ml. This is the ratio that we are using, okay? If we are taking 2 ml of picric acid reagent, we will add 0.2 ml of serum, and then we will centrifuge it, okay, at a rate of 2500 to 3000 rpm for 10 minutes. Once we centrifuge this mixture, we will get 2.2 ml of centrifuged mixture, right? And this mixture will contain the precipitate at the bottom. All the precipitate contains the proteins, the ketone bodies, all the unnecessary things that gets precipitated, and you will get the clear portion above in the test tube wherever you are centrifuging. From the clear portion you have to take 1.1 ml. Okay, this much portion that you have to take from the serum supernatant. That is why it is known as serum supernatant. Means you are first mixing the serum with the picric acid, precipitating the unwanted particles, then you are taking only the supernatant, the clean clear fluid that is in the test tube, okay? And by that process you are eliminating the protein and the unnecessary substance that can give you a falsely high value. Got it? Fine. Now this is the procedure. What we are doing in the procedure, see, we will take 3 test tubes as usual, blank, standard and test, okay? In the test tube, and this is how your sequence should be. When you are doing the performing the tests also, this is how your sequence should be, okay? First we will fill up the test tube with what? 1.1 ml of the supernatant, okay? 1.1 ml of supernatant is done, and after that whoever is preparing the test, they will wait. Whoever is preparing the blank and the standard, they will do what? Picric acid reagent 1 ml into the blank test tube, picric acid reagent 1 ml into the standard test tube. In the blank we will add 0.1 ml of the distilled water, okay? And in the standard we will add 0.1 ml of the creatinine standard. So this much portion, this B and S are almost same like before. What we used to do, we used to take the reagent, then we used to use 1.1 ml of distilled water, and in the standard we used to add standard. But in this case we are not using any of that. Can anybody tell me why? Why we are not using the picric acid, distilled water or standard anything into the tea? Supernatant. Now what is the ratio of supernatant? 2:0.2, right? From here we are taking how much? 1.1 ml. So what is the ratio? 1 ml is to 0.1 ml. This is the ratio. So over here 2 ml of picric acid only we are using. So here already the picric acid concentration is 1 ml only, like this, okay? And instead of the distilled water and the standard, we are using the serum sample. How much? 0.1 ml. So over here we are just using the mixed version, okay? That's why we are not adding any other picric acid reagent. So till now, except the buffer reagent, what is the concentration of all the BST? 1.1 ml, 1.1 ml and 1.1 ml. Right? Then in all the test tubes we will add the buffer reagent, 0.1 ml, 0.1 ml and 0.1 ml. This buffer reagent will also give us the alkaline media, right? It requires that NaOH for the test to happen, creatinine plus picric acid in the presence of NaOH. So we will provide the buffer reagent, and then after that the reaction will take place, okay? Once this much is done, this mixture is done, you have to, till now what you used to do, you used to incubate, right? over here in this test, we don't have to incubate. We have to just keep it in the room temperature. For how much time? For 20 minutes. We'll keep it for 20 minutes and after that we'll get the blank, standard and the test tube. The color change will be there according to the concentration. Fine. Now what we will do, we'll go to the colorimeter, we'll put the blank in the cuvette and we'll estimate the absorbance and we'll make it to 0. That is what we are making the reagent blank as 0. Fine. Then we'll estimate the absorbance of the standard, absorbance of the test that you have already done multiple times. So you will do that and whatever values you are getting, you will put it and yeah, that absorbance you will be taking at 520 nanometer. Fine. Using the 520 nanometer filter. Once you do that, put the values in this equation, that is the absolute absorbance of the test divided by the absorbance of the standard multiplied by 2. Why 2? Concentration of the creatinine that we are using is 2 milligram per deciliter. Whatever value you are getting, that is your creatinine value. Done? Okay, fine. Now the interpretation. How to interpret? In healthy males, normal creatinine level is how much? 0.6 to 1.2. Fine. In healthy females, what is the normal creatinine level? 0.5 to 1.1. Okay. Now if you see, in males the range is little bit higher, in females the range is little bit lower. Why? The muscle mass is more in the males as compared to the females. That is why. Fine. Now normal daily excretion of the creatinine in the urine is 1 to 2 gram per day. Okay. Or else we can represent as 90 to 150 milligram per deciliter. Can anybody tell me the conversion between these two, how can you convert? Let's say I have given you one patient whose urine creatinine level is 1.5 gram. It's normal, right? Because the range is between 1 to 2 gram per day, right? The patient is losing this much amount of creatinine in urine per day, and the patient is having 1500 ml of urine per day. Now calculate the urinary excretion in mg per dl. Can you do it? 100 mg per dl. Who did it? Okay. How? 1.5 gram divided by 1500 ml. This is gram per ml. We have to convert it into mg per dl. Right? So 1.5 gram means how many grams? 1500 grams. 1500 mg. Right? 1500 mg and 1500 ml means how much deciliter? 1500 ml to deciliter. How much will be in deciliter? 15 deciliter, because in 100 ml 1 deciliter, right? 15 deciliter. So your conversion comes, divide अगर करोगे तो फिर आएगा 100 mg per deciliter. So this is the conversion. Okay. So if you are thinking like 1.2 gram per day, from how much? How come this comes? Okay, so that is what the explanation is. Okay. Now, why do we need it in mg per deciliter? Why cannot we use it in 1.5 gram per day? That is what you will get to know when we will be going into the clearance. Okay. When we are going into the clearance, that time I will explain that part. Now, increased levels are observed in renal failure or renal disorder, any types of nephrotic disease, nephritic disease, glomerular nephritis. You will get this creatinine level to be high. Okay. Now muscular dystrophies are different types of muscular dystrophies are there. When you will be reading in physiology, you will get like Duchenne muscular dystrophy, then Becker's dystrophy. These are there. Then poliomyelitis in the early stages. Okay, and these are the clinical conditions when you can get increased level of the creatinine. Okay, and then high catabolic states such as fever. In fever also you can get increased amount of creatinine, but mind it will not be that severe as it can be seen in case of a kidney disorder. Okay, in kidney disorder it can be more than 2, 3, 4, 5, 6, 7. Okay, but in case of fever, as compared to your normal, it could be more by 0.2, 0.3, 0.4 up to this much. Okay, if somebody has fever and they have went into sepsis, and because of that some organ is dysfunctioning, that time they can get. Okay, initially because of fever it can be little bit of here and there, little bit of mild rise can be there. Got it? Now, when you can have decreased level of serum creatinine, that is decreased levels can be seen in case of muscle wasting. If you are losing your muscle mass in the later stage, you will have decreased level of serum creatinine. Fine? Okay. Next. Now, what are the limitations of this test? Okay, this test has certain limitations. What are that? First listen, then I'll give you the time to write. Okay, first is Jaffe's reaction is non-specific and pseudo-positive result to acetone acetoacetic acid. I have told you that ketone bodies are there in our body which can react with the picric acid and can give the same color chromosome and which can give you a falsely high result. So somebody who is having diabetic ketoacidosis and you are taking the blood sample of that patient, definitely the creatinine level can be higher from the normal because of the excess amount of acetone and the ketone body, acetone and the acetoacetic acid that is present in the patient's body. Fine, that is one limitation of this test. Second thing is lack of specificity. Lack of specificity means when whatever color component we are getting by saying that let's take a patient's blood sample, we are putting it with the picric acid and we are seeing the color change. Okay, the color change whatever is happening, 80% of it is because of the creatinine and rest of the 20% is because of the some other substances that is also present in the blood. What can be the other substances? That can be protein, urea, ascorbic acid, glucose, all of these things. Okay, this can give you rest of the 20% of the color compound. So this is also becoming non-specific. Why? Because if you are doing the test, your value is coming, let's say 1.2, 1.3 or say let's say 1.4. The creatinine is responsible for 1. Rest of the 0.4 is because of some other particle. So that is the non-specificity. Okay. So that is another limitation of this test, that it can be positive by other substances as well. What are the substances? Glucose, uric acid, urea, proteins. That's all. Fine. Third limitation is the values can alter depending upon the pH and the temperature of the sample you are taking. Now, how is it important? Let's say a patient is having diabetic ketoacidosis. Diabetic ketoacidosis means diabetes is there, ketosis is there and acidosis is also there. When we will say acidosis? When the pH is less than the normal. What is the normal? 7.35 to 7.45. Less than that. So the patient who is having ketoacidosis, obviously their blood is already acidic, right? So in that acidic pH, if you estimate the serum creatinine, you will get an altered value, which is not the exact value of the patient. And the temperature, somebody who is having severe pyrexia, severe fever, temperature is more than 1.104 degree, like that, and that time also you will get an altered value of the serum creatinine. So these are the things that can alter. Okay, the room temperature where you are testing the sample, that is also affect. Fine. Okay, so these are the limitations of this test. Fine. Now we will be going to the creatinine clearance. So this creatinine clearance will again be taught to you in your theory classes. Okay. For now, get the idea what is creatinine clearance so that you can correlate that time as well. What is clearance and why is it important? Okay. You have heard about the term that GFR, right? What is the full form? Glomerular filtration rate. What is the need of GFR? Why do we have to know about GFR? Kidneys what? Functioning properly or not? What is the normal value of GFR? 125 milliliter per minute. Okay. This is our exact value. Up to how much is normal? If it comes between 90 to 125, that is normal value. Okay. This is the optimum value. How to estimate GFR? How to estimate GFR? We are saying that GFR is this much ml per minute. But how to estimate it? By seeing the clearance. Okay, by seeing the urea clearance, creatinine clearance, inulin clearance. These all things you can do and you can get the clearance or the GFR value. Okay, now there are three things. One is inulin. Second is creatinine. Third is urea. These are certain examples. There are many more. I am just giving you 3 examples. Now, if you do this clearance test with inulin, you have to give it from outside. We will give an injection, okay? And then whatever inulin we have given, exact amount will come out through the urine. It will not get absorbed by the body. It will not get absorbed by the kidney. Neither our body can release inulin. So whatever amount you are giving, it will come out. And by this, if you are testing in a normal person who is completely healthy, you will get exact value of the GFR, right? So that is why inulin is considered as the gold standard to estimate the GFR. Gold standard means nothing is better than this, okay? But we don't use it. What we use it? Day-to-day life, creatinine. This is the commonly used. Creatinine clearance is commonly used to estimate the GFR. Now urea, why we are not using the urea? I have told you, because urea get absorbed by the kidneys. Some bit of urea can get excreted by our body as well. So this is not the optimum for estimating the clearance or the GFR. We are using the creatinine to estimate the GFR. Fine. Okay. Now, what is the clearance? Clearance of a substance is the volume of plasma completely cleared of the substance per unit time by both the kidneys. Understood? If not, think the beginning of my class what I said. If there is some amount of substance which is present in your plasma, both the kidneys over a period of minute, how much amount of that substance can clear out, that is known as clearance. The words are little twisted over here because this is the definition and that is how definitions are. Can't help it, but the exact meaning of clearance is whatever amount of substance is present in your plasma, of that substance, whatever amount both the kidneys can excrete in 1 minute of time. That is what is ml per minute. Let's say GFR, glomerular filtration rate, means kidney can filter out 125 ml, both the kidneys can filter out 125 ml of fluid per minute. That is your clearance. Got it? Now, it is expressed in ml per minute. Fine. Creatinine clearance is defined as the volume of plasma which is completely cleared of creatinine. Okay, the volume of plasma which can completely excrete the creatinine in 1 minute by both the kidneys. Fine. Now it is calculated by the following formula, that creatinine clearance is equal to U into V divided by P. Now what is this U and V and P means? U means the concentration of the creatinine in the urine. Second is P, concentration of the creatinine in plasma, and V is the volume of urine passed per minute. Now, can anybody tell me how can you estimate the volume of urine that you are passing per minute? How to estimate it? Arey nahi yaar. Volume of urine that you are passing per minute. GFR is your kidney's function that you are estimating. How much urine you are passing per minute, that you cannot estimate with your GFR.
Say in 24 hours.
Yeah.
1500 ml.
Yeah, that I was saying, but how to estimate it? Let's say you are coming to me right now saying that I want to estimate the volume of urine that you are passing per minute. Right now, if I tell you pass some urine, I don't know from when you are holding your urine, right? So first thing I'll tell you, go and void. Okay, your bladder is completely empty now. Now from this moment, I'll give you a bucket or give you a container. Over here, you will keep on peeing till tomorrow this time. Okay, so whatever urine output you are getting till tomorrow, that is your 24-hour urine output. Let's say the patient's urine output is 1500 ml over a period of day, over a period of 24 hours. So your volume of urine passed, that is V equal to 1500 ml divided by 24 into 60 per minute. Understood? From where this 24 and 60 came? 24 hour, each hour containing 60 minutes. So that is what is 1500 divided by 24 into 60, that is the ml per minute. Got it? So this much is your V. Now the second thing comes. Now whenever we are using the concentration of the creatinine in the urine and the plasma. In the plasma, what is the normal value of creatinine? In the plasma or the serum, what is the normal value of creatinine? 0.6 to 1.2 0.6 to 1.2 mg per dl. Right? Now if I am putting the same equation, can I put it like U into V divided by P? Okay. Now over here what we are having, V. V is how much? 1500 divided by 24 into 60, right? The V we got. P we have how much? 0.6 to 1.2. Let's say it is 0.8. Normal only, right? So P we got 0.8. Now over here, can we write 1 gram per day?
No.
Can we calculate with that? We will be requiring the U in the exact same mg per dl, so that the mg per dl get cancelled and the value comes in ml per minute. Got it? And that is why we have to convert that 1.5 gram into this ratio. That is 100 milligram per deciliter. Now if we put this thing over here, 100 into 1500 divided by 0.8 into 24 into 60. Do the calculation. Somebody just use the calculator and please tell me what is the value you are getting. 121.2 mg per dl. So is it normal? Is it normal? Why? Why normal? Because the range is between 90 to 125. It is coming in between that. Okay. Now the normal range can be up to 140 as well. Please see over here. Now the normal range can be up to 140 in case of males, in case of females up to 125. Okay. This is for our calculation. Now thing is, anybody has any doubt in understanding this much portion? Please raise your hand or ask. Anybody has any doubt? Yeah, say. This portion. See, volume you have understood? Whatever volume of urine you are getting divided by the time period. You are getting your V. P you are estimating. Right now you will estimate. Okay. And urine. The concentration of the creatinine in the urine, that we are not estimating right now. That is why I have just given you. Let's say it is 1.5 gram, which is a normal. Right? Between 1 to 2 is normal. So 1.5 gram I have given you. Later on, when your theory part is covered, that time you will do both the steps. The serum urine and creatinine and you will calculate it. Okay. Right now, if you see 1.5 gram comes how much? 100 mg per dl. This conversion you have understood. So this is your U. This is your P. This is your V. Just put it in the formula and whatever you are getting, that's all. Okay. Got it? Now, if you are getting over here 2, then the value will be different and that value will come. Whatever you are getting in the value, you will just put it up. I have just showed you like why this gram per day is not necessary for us. We need mg per dl. For what? For the equation to solve. Got it? Don't ever put instead of 100 that 1 gram. Then your value will completely change. You will never get this value. Okay? Just keep these things in mind. That's all. What are the normal values? In males, it is 95 to 140 ml per minute. Okay? We are talking about clearance now. Okay? We are not talking about creatinine anymore. So the clearance is, in case of male, it can be 95 to 140. In case of females, it can be 85 to 125. That I have said over here. Okay? In case of males, it can be up to 140. In case of females, it can be up to 125. Now the creatinine clearance is decreased in case of renal impairment or the renal function is impaired. Yeah, mg per dl. Oh, sorry. This will be ml per minute. Sorry. This kept over there. ml per minute. Now why ml per minute? See, this 100 mg per dl. This is 100 mg per dl and this is 0.8 mg per dl. Both are getting cancelled. Mg per dl are getting cancelled. Only ml per minute is remaining. Fine. Okay. Now over here, 85 to 125 ml per minute and creatinine clearance is decreased in case of renal impairment. If it is less than 90, then you can understand the kidneys are not functioning properly. That is why the clearance is also decreasing. Okay. What is the meaning of this? Let's say this is your glomerulus. Filtration is not happening. The kidneys are not functioning properly. That is why the filtration is not happening. If the filtration will not happen, then the clearance will not be high. Clearance will be low. Okay. Now, creatinine clearance is a good indicator of GFR. In the beginning of the class, I told we are using what? Inulin, creatinine and urea, everything we are using. But why creatinine is a good indicator or a better indicator as compared to urea? Because creatinine is freely filtered by the glomerulus, neither get secreted nor get reabsorbed by the renal tubules. Neither the kidneys are secreting creatinine, neither they are reabsorbing the creatinine. Whatever creatinine is coming, they are getting filtered out. Fine. So that is why it's a good indicator for the GFR. Now, in average, what we are saying that 125 ml per minute is taken as a 100% clearance. It means if a patient is having the clearance of 125 ml per minute, we are saying that this is 100%. Fine. Everything is getting cleared out. Now, if we take catch hold of 125 as a 100%, up to 70% value is catch hold of as normal. Let's say somebody is having 100 ml per minute. What is the percentage? 100 divided by 125 into 100. What we are getting? 80%. Right? Fine. If you are getting 80%, then it is coming under normal. So eventually if it is getting less than 90, then only you will get the value as less than 70%. If anything less than 70% is abnormal kidney functions. Now the more, the less, the worse the prognosis of the kidney. Okay, if it is between 50 to 70% criteria it is following, it is mild renal damage. If it is 20 to 49%, it is moderate renal damage. And if it is less than 20% it is coming, then that indicates it's a severe kidney damage. Fine, that's all. Standard. यहाँ से नीचे तुम्हारे नीचे देखिए छोटे सैंपल नीचे लिखिए